Let's talk about interventional orthodontic treatment. Those are for the kids that are between maybe 4 and 5 and 10 years old. What are we looking for? We're looking for kids that have large overjets. Their front teeth are really protruded. We're looking at those kids who have a posterior crossbite. Maybe their upper jaw is too narrow. We're looking at airway issues. If kids are having a hard time sleeping and they're snoring and they're grinding their teeth, do we need to make more room for that tongue? Let's talk about early intervention for lifetime improvements. Say you have a crossbite. That means your upper jaw is skinnier than your lower jaw. If we can get you in at 7 or 8, we can easily expand that whole palate. We can make that jaw wider so that when the permanent teeth ultimately erupt, they don't erupt into a crossbite. You don't start developing these functional problems where your jaw has to accommodate for where the other jaw is and your teeth start wearing down. Our goal is to just get you in a better spot skeletally so that when the teeth ultimately grow in, it makes your straightforward orthodontic treatment with braces or Invisalign much more in line with what we're looking for and hoping for. Let's talk about early orthodontic intervention with kids who have protruded teeth. What's the risk? The risk is trauma. If your teeth are sticking outside of your mouth, you trip and fall on the playground, what's going to be the first thing to hit? It's going to be those front teeth. Our noses aren't even ossified. They don't turn into hard structures until we're older. So that first tooth that comes down and bangs, it's a risk. So then the rest of our lives we're dealing with this broken front tooth that we constantly have to repair. So what do we do in the orthodontic office? We try to bring those teeth back in the mouth. We try to get you into a range where it's not so risky. It looks better too, right? But then we don't worry about you breaking this front tooth that you're going to have to deal with the rest of your life. In my own family, I started with my 7-year-old because she had some problems, and I tried to give her that beautiful smile and make it as easy as possible. I'm looking forward to doing that with your family and with your young one. I want them to have that big, beautiful smile that they've always hoped for and give them the confidence that they deserve to make it through this world.